We're going to see the recommendations for the BRCA testing, screening testing. The BRCA1 is associated with medullary breast cancer, and the BRCA2 is associated with male breast cancer. So the recommendation would be if a patient has a familiar history of fallopian tube, ovarian, or primary peritoneal tumor. If the patient has at least two relatives with breast cancer, if the patient has a personal history of breast cancer under the age of 50 years of age, if the patient has a personal history of breast cancer triple negative under the age of 60 years of age, if the patient has two primary breast cancer tumors, or if the patient has a male family history of, that is a male relative, that is the father, the child, the son, the father, the brother, something like that, has a history of breast, prostate, or pancreatic cancer in two relatives. So this could be the indication. For example, now, in one woman that we would not recommend the testing would be, for example, a older woman, 70 years of age, with breast cancer and no family history of that, or with your one relative of breast cancer, something like that. So we have familial history of fallopian, ovarian, or primary peritoneal tumor, two relatives with breast cancer, male relatives with breast, prostate, or pancreatic cancer on two relatives. The patient has less than 50 years of age and has breast cancer. The patient has less than 60 years of age and has breast cancer triple negative, or the patient at any age has two breast cancers.